All right, you guys, Ralph Havens here, Beyond Limits Physical Therapy in Bellingham, Washington. And I'm going to show you some techniques to release tension along the connective tissue, the fascia, that encompasses, that encases arteries, nerves, veins, and lymphatic vessels. It's a way to get more length in the body. So without a lot of explanation about it, I'm going to just go right to it. And you can try it, see how you feel before and after. You may feel taller. I've had people tell me they get better peripheral vision after doing this. So here we go. We're going to start with the lower body because it's a little easier. And what you're going to do is find the inner part of your knee, and you just slide your fingers up, and you'll come to a little divot. So go to that divot, and then we're going to take that divot, the skin, and just move the skin towards your pelvis. And then move the skin down or up, and just pick one direction. Pick a direction that feels easier. In my case, when I move up, and then when I move up this way, it feels a little easier than down. So I'm going to go towards the pelvis and then up towards the ceiling. And I'm going to twist the skin a little this way and a little this way, and I picked the easy way. So I went this way, up, and then I twisted. So in your case, you might be going the other way. Then you put your other hand on your top of your heart area, and you pull the skin of that down. So what we're doing is we're shortening the length between this little connective tissue area where the femoral artery, nerve, and vein go through, and the heart. And when we shorten it, it takes a lot of stress off the body. So we're going to hold it for about a minute. You can hold it longer, and we're just going to hold it. You might want to have a clock around so that you hold it for at least a minute, but you can hold it longer. And you may feel some unwinding or some relaxation happening in the body. If you don't, it's okay, it still works. Okay, and then we'll do the other side. So you find the inner part of the knee, and you just slide your fingers, and you'll come to a little divot. And I'm going to take that divot towards the pelvis, take the skin towards the pelvis. I'm going to go down or up and pick the easy way. In my case, going up is easier. I'm going to twist and pick the easy way. In my case, this way. So I've gone up, and I've twisted. And the other hand goes on the top of the heart and pulls it down. So we're shortening that area, and we hold it for about a minute. If you did just this one, you'll have a profound effect on your body. And we will do, let's see, 1, 2, 3 other ones in each foot, in each leg, and 3 in each arm, besides these. But this, if you did just this one, you'd feel very, very good. And again, some of you may be feeling some unwinding or some relaxation. You can hold it for at least a minute. You can hold it for longer. Okay. Now the next ones are a little more involved, but we'll just go through it, and you can do the best you can. So what you can do is take the from the side of the leg. Let's just see if I can get a good picture here. From the side of the leg, there's a little bump there. On the front of that little bump area, that's the fibula, we're going to slide down just a little, and there's a little divot. So you're just going to like right about there. And then take the other hand and you put it on your heart. Your heart area, you pull down towards your pelvis. This little one, we're going to go up towards the knee and then twist and twist the easy way. So in my case, this is easier. And then I'm going to go this way, and I go the easy way. So it's this way for me. So I went up, over, and twisted, and then this hand goes down, takes my heart down. And so you can see we're shortening the area between that little spot on the leg and the heart. And hold it for a minute. And again, some of you may be feeling some unwinding, some relaxation. Okay, and then on the lower leg, there's the little bump, malleoli, just to the inner edge of that. On the front, you go up just a little, and there's a little divot right there. So I'm going to hold that. I'm going to go up towards the knee. Then I'm going to go this way or this way and pick the easy way. In my case, it's that way. I'm going to twist, and in my case, it twists a little easier this way. So I went up, that way, and twist. And then the other hand goes on the heart. And you pull the heart down towards the foot. And just hold it for a minute. I'm pulling the heart hand down. I've been wanting to make these videos for a while because these techniques are so profound. And while it takes some training to do it, I find that it's not that hard to get somebody to do it to themselves. So you can do it as often as you want, every day, a few times a week. You don't have to do it every week, but if you're dealing with some sort of chronic pain, it could be useful. After about a minute, you can relax. Then we're going to do that same foot, and we're going to go on just on this side of the joints. So you got the little foot joints. You just go a little bit more towards your heel. So just like, whoop, but just a little. And then you're going to bring it up towards the heel. And I'm going to go left and right and pick the easy way. In my case, to the left is easier. And I'm going to twist the easy way. So I went up, over, and I twisted, and the other hand goes on the heart and pulls it down. We go for a minute. Takes a little time, but man, oh man, does it make you feel good. And after about a minute, then you can relax. We'll go just a little bit more to make sure we get the minute in. Okay, and then relax. So we'll do the other side, just so that you got a video for all of it. So the inner knee. Oh wow, there's my friend is coming. Okay, yeah, so we'll do the right side now, just so that you have that in your awareness. And we go on the right side right here. We find the side of the knee, the little bump, and just in the front of that little bump, we go down just a little, you'll find a little divot, and you push that skin up towards the knee, then front to back and go the easy way. In my case, it goes easier that way. I twist the skin and go the easy way. So I went up, in, and like that. And then I take the other hand on the heart and pull it down. And we hold that for 1 minute. So we'll estimate, we'll get at least a minute in. If you hold it longer, it has a more total body effect. Okay, after a minute, you can relax, and then we're going to go the little bump here, the malleoli. You go just to the front of that and go up, and you'll find a little divot. I'm going to go up towards the knee. I'm going to go this way or this way. Pick the easy way. In my case, it goes easier this way. I'm going to twist and twist the easy way. So I went up, forward, and twist, and then the other hand goes on the top of the heart and pulls it down. So we're shortening that area between that little spot on the foot or the ankle and the heart. And when we shorten it, it takes a lot of tension out of the body, and we just hold it for a little bit. You can hold it longer than a minute for a more profound total body effect, but at least for 60 seconds is good. This is called strain, counter strain. Okay, the next one is for the foot, and you just find the bones. Here's the ankle joint, or the toe joints. Just go a little bit this way, and then push in a little, and I'm going to pull that towards the heel, and then I'm going to go left and right, pick the easy way, twist, and pick the easy way. So I'm going to go up to the left, and then twist this way, but go the easy way for you. You pull up towards the heel first, then the other hand goes on the heart and pulls it down. Hold it for a minute. I encourage you to walk around before and after when you do this, because you'll feel the difference in how you move and how, even like I said, that one guy had his vision improved doing this. Okay, and now we're going to do the same kind of thing for the upper part of the body. And what you can do is on the thumb side, there's a little indentation where your radius bone comes up, but you just go down a little bit and there's a little divot. So it's like just going to find an area somewhere in here, and you're going to feel for a little divot. And so when you feel that divot, you're going to bring it towards the elbow, and then you're going to bring it left and right the easy way, and twist the easy way, and the other hand goes on the heart. I'm going to just adjust my fingers a little. The other hand goes on the heart and pulls the heart up. This time you're pulling the heart up, and the reason you're pulling the heart up because you want to shorten the area between the heart and this little divot. So we've got the little divot that's going up towards the heart, and then moving a little bit left and right the easy way, and also twisting the easy way, and the heart hand goes up towards the head. So we're shortening that area between the heart and the elbow area. Hold it for a minute. I feel a lot of release, a lot of relaxation, taking tension off of those arteries, nerves, veins, and lymphatic vessels. If you don't feel anything, that's okay, it still works. Okay, the next one is on the thumb side. You just go up a little bit from the wrist, and there's a little divot right there. I'm going to pull it up towards the elbow, then I'm going to go left and right the easy way. I'm going to twist the easy way, and then maybe even use a thumb. So I'm going to go up to the elbow. You're going to go like this. Up to the elbow, left and right the easy way, twist the easy way. The other hand pulls the heart up towards the head. So the part in the wrist area pulls towards the elbow, the part on the heart pulls towards the head. And if you have a hard time doing it like that with the heart hand, we can do it a slightly different way. I'll show you. And that's to put your hand on your belly button area. First, we go find this spot on the thumb side. From the top here, you just go down, and there's a little divot. And I'm going to take that divot towards the shoulder, or towards the elbow, then up and down, go the easy way, and then twist the easy way. You can put your hand on your belly button and just bring your belly button up towards your head. So if you can't reach your heart easily, you can reach your belly button and pull it up. And the part on the elbow area pulls towards the elbow. We're shortening that space between the elbow and the belly button. Almost done. We got 2 more to do. It's a way to take a lot of tension out of the nervous system. Okay, and we'll do one more, and then we'll get to the hands. So we go right there between the thumb, on the thumb side, there's a little divot right there. I'm going to pull it up towards the elbow. I'm going to go down or up the easy way, and I'm going to twist the easy way. And the other hand's going to go on the belly button area and pull the belly button towards the head. The spot on the wrist goes towards the elbow. The spot on the belly button goes towards the head. Okay, and then for the hands, here's the knuckles, just a little bit this side of the knuckles. You put the little finger side right here, and you know the drill. We're going to go up towards the elbow, we're going to go down or up the easy way, and we're going to twist the easy way. So I'm going up to the elbow, I'm going to go the easy way up or down, and then twist. And then the other hand goes on the belly button and pulls the belly button skin up towards the head. We'll do a minute. Once you get these down, you can do them without thinking. And just when you're watching a video, do a few. You don't have to do all of them at one time. You can just do both hands, or you can do both elbows or both wrists. You can do just do that one that was for the inner knee or the feet. Some of you may be feeling pretty profound shifts right now. And we'll do one more. So here's the knuckles. You're just on this side of the knuckles. I'm going to go up towards the elbow, left or right the easy way, and then twist the easy way. And the other hand pulls the belly button skin up towards the heart. These are physical techniques to improve physical conditions, and because it works on the autonomic nervous system, it takes tension out of that autonomic kind of nervous system. So you might feel more relaxed, less anxious. Life gets better. Okay, so my name is Ralph Havens, physical therapist here in Bellingham, Washington at Beyond Limits Physical Therapy. Reach out to me if you're dealing with a chronic injury, a chronic pain, some sort of health challenge that's not getting well. If you're not getting the answers from your practitioners, reach out to me. We could do a mapping assessment, find out what the root cause is for you, and get you on your path to healing and getting your health and life back. So if you're a runner or an active person, or you want to get back to being active, reach out to me and we can help you out. The address is ralphhavens.com and 360-599-2217. We're in Bellingham, in Fairhaven by the Village Green, and I will see you all very soon.